Hello viewers, I am Dr. Robiul. I am an assistant professor of pathology in a medical college hospital and I am making this video for my students and also for you. Hope someone finds this helpful. Today's topic is on alpha thalassemia. This is the second lecture of our ongoing thalassemia lecture series. In this lecture, we will learn what do we mean by alpha thalassemia, what is the underlying genetic mechanism of alpha thalassemia. We will also talk about the classification, clinical features, lab diagnosis, and treatment of alpha thalassemia. Okay, a lot of topics, so let's begin. First question, what do we mean by alpha thalassemia? It is a genetic disorder in which there is reduced synthesis or absence of synthesis of alpha globin chain. Recall that alpha globin chain is required for production of hemoglobin A, hemoglobin A2 and hemoglobin F. Hemoglobin A is the main hemoglobin in adult life and it is composed of 2 alpha globin chain and 2 beta globin chain. Hemoglobin A2 is present in small percentages in adult life and it is composed of 2 alpha globin chain and 2 delta globin chain. And hemoglobin F is the predominant hemoglobin in fetal life and it is composed of 2 alpha and 2 gamma globin chain. So the point I'm trying to make here is in alpha thalassemia, since there is reduced production or absence of production of alpha globin chain, hemoglobin A, hemoglobin A2 or hemoglobin F in case of fetus, these hemoglobins may be reduced, but that will depend on the type of alpha thalassemia as we will see. So now that we have defined alpha thalassemia, now let's talk about the underlying genetic mechanism, and in short it is gene deletion. In the short arm of chromosome number 16 we have 2 genes that can encode alpha globin chain. Since we have 2 chromosome 16 in each diploid cell, so in total we have 4 genes that can encode alpha globin chain, and either 1, 2, 3 or all 4 of these genes can be deleted. So that is the underlying mechanism. And one nice thing to know, if we compare the mechanism of alpha thalassemia with the genetic mechanism of beta thalassemia, we will see that here the mechanism is gene deletion, but in case of beta thalassemia the main mechanism was gene mutation. Yes, rarely gene deletion can also occur in beta thalassemia, but mainly the underlying mechanism for beta thalassemia was gene mutation. So that's a nice thing to know. So now let's classify alpha thalassemia, and we will classify alpha thalassemia based on the number of genes that are deleted. So we are writing the normal alpha gene as alpha, and we are using this symbol to denote deletion. So if only 1 out of the 4 alpha genes are deleted, that will result in a condition known as silent carrier. What will happen in silent carrier if we talk about the clinical feature? As the name implies, it is asymptomatic. So the person will have no symptom, the person will have no anemia, and only in the peripheral blood film we will see slight microcytosis. So the red blood cells will be slightly smaller, but that will be asymptomatic. The person will not have anemia. So silent carrier will also require no treatment. Now if 2 out of 4 genes are deleted, that will result in a condition known as alpha thalassemia trait. Now 2 genes can be deleted from the same chromosome. This type of deletion is known as cis deletion, and 2 genes can be deleted like this, that is 1 gene is deleted from 1 chromosome and another alpha gene is deleted from another chromosome number 16. So this pattern of deletion is known as transdeletion. Now cis deletion is common among Asian and Southeast Asian, whereas transdeletion is more common among African population. Now the examiner may ask you, what is the importance of cis and trans deletion? Basically, the person with cis deletion and the person with trans deletion they will have same clinical feature. The difference will be in their children. Children of a person with cis deletion will have more risk of developing more severe form of anemia. So what will be the clinical feature? The clinical feature will be asymptomatic, or there may be mild anemia, and if we do lab diagnosis, we will see that there will be mild anemia and mild microcytosis. If 3 out of 4 genes are deleted, that will result in a condition known as hemoglobin H disease. Basically here the beta chains are forming tetramer or beta 4, and in fact hemoglobin H is another name of beta 4 tetramer. So the clinical feature of a person with hemoglobin H disease will be similar to that of beta thalassemia intermedia. So there will be fluctuating level of anemia. The anemia may become more severe during pregnancy or during infection, and as we will see in the lab diagnosis, these individuals will have moderate anemia. Hemoglobin level will be between 8 to 9 gram per deciliter. There will be microcytic hypochromic red blood cells. There will be target cells, nucleated red blood cells. And one interesting thing that you have to remember, that hemoglobin H or beta 4, they tend to precipitate, and by using brilliant crescent blue we can also visualize that. So we can also visualize those hemoglobin H precipitate, and they are known as Heinz body. So that's a nice thing to know for your multiple choice exam, and we will see that in hemoglobin H disease. Now, if all 4 genes are deleted, that will result in a condition known as Hydrops fetalis. It is seen in the fetal life, and basically here we are seeing formation of gamma 4 tetramer. Now regarding clinical feature, this is the most severe form, and usually this type of fetus is not viable and they are incompatible with life unless intrauterine blood transfusion was done. Nowadays intrauterine blood transfusion is possible, and so these fetuses do survive, many of them, and however they will suffer from severe anemia and they will require lifelong blood transfusion. And hematopoietic stem cell transplant is now a curative option. So what will be the lab diagnosis of an individual with Hydrops fetalis? There will be severe anemia, and there will be microcytic hypochromic red blood cells. There will be target cells, abundant target cells, abundant nucleated red blood cells, and the reticulocyte count will be also elevated. And the hemoglobin electrophoresis, just like thalassemia, beta thalassemia, is also done in case of alpha thalassemia, and I will also show you the hemoglobin electrophoresis findings of different types of alpha thalassemia on the screen. So this concludes our short lecture on alpha thalassemia. I hope this lecture was helpful. Until next time, take care and stay blessed. Thank you.